Hello and welcome to another episode of Afghan Views, a platform on the Awarelogue Initiative where we explore different voices coming out of Afghanistan as we look back 6 months after the fall of Kabul. Our guest on this episode is a medical doctor, Dr. Shohra Qaderi. She's currently based at the Shahid Beheshti University of Medical Sciences in Tehran in Iran. Dr. Qaderi is joining us for an audio interview on this particular episode. Thank you very much, Dr. Qaderi, for your time, for joining us, for sharing your views and helping us understand the medical perspective of what is going on in Afghanistan and what some of the related problems are and the impact it is having on the people of that particular country. So welcome on board once again, Dr. Qaderi.
Thank you very much, and thanks for allocating a program about Afghanistan.
Dr. Qaderi, if I were to start by asking you, the pandemic has taken a toll around the world. We've seen this problem not just in one country, but in so many countries around the world. How critical is the COVID-19 situation in Afghanistan at this moment?
Well, I would like to start my statement like this, that Afghanistan has been experiencing a deadly combination of COVID-19 pandemic plus the Taliban group at the same time. And cases in Afghanistan are rising and increasing day by day. And as WHO or World Health Organization shows, the trend of COVID-19 cases are increasing. It has an increased trend. Besides all these, Afghanistan has a low number of vaccination across the country. For example, Afghanistan home to over 35 million people, but about 5 million of people has taken its vaccination, and we are not sure about the second and third doses of the people inside the country. Actually, the phenomena I'm afraid of is about a COVID-19 peak in the country. If Afghanistan would face a peak experience a peak in COVID-19, the country would not be able to deal all these issues because we have a severe lower level of experts in this field. Even it's hard to find a pulmonologist in Afghanistan. And also we have lots of unequipped hospitals that they cannot address the demand of the people. So I think, pandemic itself is a huge threat to the people of Afghanistan.
Dr. Qaderi, obviously there are other bigger problems that people are dealing with. They're trying to make sure that their livelihoods are being looked after. They're trying to put meals on the table. But are the COVID-19 protocols being followed across the country? Are people mandated to wear masks? As you mentioned, some people have already received the first dose of the vaccine. It's very doubtful about the second, and a booster is probably not thought of even at this moment. But are basic protocols being followed across the country?
Yes, thank you. My answer to this question is no, unfortunately. Due to low level of health awareness between the people and also low level of health education between the people, including the political elite, do not consider these measures about COVID-19. For example, right now, we do not have any containment measures all across the country. For example, mosques, the religious places that people pray is open, and it would become so crowded during prayer time. And also, wearing a mask is not an obligation in entire country. So I think it's a huge problem and concern in country.
Mm-hmm. Mm-hmm. If you look at the health sector as a whole, Obviously, COVID is a massive issue that the country is dealing with, and I'm sure the entire health sector is under severe strain as well. How badly affected is the entire health sector of the country?
Say that Afghanistan has always been heavily relies on outside world aid and help. And health sector is one of the sectors that it has always been supported by outside world, like health organization, World Health Organization, and others organization in the country. So when the Taliban took over the country, most of organization that they helped Afghanistan in health, including education sector, they left Afghanistan behind. So Afghanistan has experienced a severe strain about this. For example, a majority of immunization in Afghanistan has been supported by outside world. It has been declined significantly. Actually, it's a start recently. I should mention this. And for example, the maternal health in Afghanistan had been provided by international organizations. For example, the maternal kits, the neonatal kits. But after the Taliban, I think the maternal health is experiencing a severe form of, it's getting bad, and it's a severe concern, I think. The malnutrition, and you're seeing that more than 20 million.
Dr. Qaderi, if I were to ask you, in a recent paper that you wrote, you talked about the daunting task of fighting HIV in Afghanistan. Could you describe the situation in the country?
Patients or the people who are in under a restricted and so bad situation. And there are 2 points so much important about the people with HIV. The first one is social stigma, because it's like a taboo is having HIV in the country, making you so isolated and making you like a foreigner from the mass of the population. And the second one is the way that the people are affected HIV. The main way that people are affecting HIV in Afghanistan is illegal drug abuser. So it's like a signal for other peoples that if a people has HIV, if a person has HIV, it means he is or she is addicted. And after the Taliban take over the country, both of these situations has experienced worse situation and exaggerated. And also, for example, the HIV medications that mainly are antiviral medications, they are expensive and they mainly imported in the country. So due to outside world left Afghanistan, the people experience, the people with HIV do not take their treatment regularly nowadays. And also, Afghanistan has never had a program for mothers who are living with HIV, and the situation is getting worse by the Taliban government. So I think we would face with an increased number of people with HIV, and also the worst one, the neonate. They are I mean the positive HIV mothers who give birth neonate with having HIV would increase in the country.
Mm-hmm. Dr. Qaderi, obviously people are finding it very hard to find food to meet their daily requirements. Malnutrition has increased drastically across the country. What measures need to be taken urgently to address this issue?
It is hard to answer because I think everything has broken into pieces, even humans break down. So broader measures, a huge number of measures should be taken into account to alleviate the situation in Afghanistan. And for immediately, sure, we need international organization to help us with this, like the World Food Program, WFP. For the health aspect, we need WHO to help us, and other organizations, they are capable to work in this situation, like UNICEF. And also the second and important thing, I think, is the empowerment of internal capacity. And also, we should never forget the vulnerable group in Afghanistan, that they are women. Being a woman, I like to say it's like a risk factor in Afghanistan. You mean it's being a woman would make you suspected to anything. So we should not forget women, and we should fight for their rights and also for their education. That now it's not so open in the country or restricted.
Absolutely. Dr. Qaderi, you mentioned certain international aid agencies. You mentioned World Food Program. I'm sure there are organizations like the World Health Organization who are very much involved in what is happening in the country. How confident are you that these international aid agencies will help Afghanistan overcome the current health challenges? Because obviously you do not want to have the harshest aspect of a pandemic spreading. You don't want to have disease, diarrhea, other problems spreading across the country. This is the last thing that you need. Afghanistan has just gone through a very bitter winter, which is still continuing, I do believe.
Yes.
It's extremely hard, and it's a very harsh winter from what we have heard. How confident are you that these international aid agencies are going to be able to have the appropriate funding to carry out programs in Afghanistan at this moment?
If I want to answer this question personally from my own perspective, I'd like to say a miracle should happen to alleviate all these crises. And I do believe that international agencies only would not overcome all these crises in Afghanistan unless broader measures should have not been taking place in the country. Besides international health allies, we need the government of the Afghanistan to alleviate. It would play a crucial role, and also the people itself will play a crucial role. So based on this question, I think international community would not overcome this situation alone.
Mm-hmm. You used a very appropriate word there, Dr. Qaderi. You said Afghanistan needs a miracle right now to overcome some of the challenges that are besetting this country, challenges which have been growing exponentially. They've been challenges which have been there for decades now, as we have seen throughout history, if we go back several decades as well. You mentioned the international community. Dr. Qaderi, as a medical professional, when you look at your country, what do you think the international community has to prioritize when it comes to Afghanistan? We heard about talks taking place recently in Norway, but of course their humanitarian aid was being coupled with human rights. Now, there are certain practicalities that have to be worked out, how these things are going to be implemented. But what must be done right now? What can the international community do? What should neighboring countries be doing to help Afghanistan?
Oh, actually, it's a hard question, because we entered to a bad situation, and to answer this question, I should say that a single demented measure, a single demented program would not solve the current drastic situation of the country. We need a multi-dimensional programs to cover lots of aspects in Afghanistan at the same time. For example, the World Food Program would help people, the people who are starving, with distributing the food and the basic amenities. or the WHO with their health, providing health equipments and other things related to health. And also the economic of the peoples has been working. I do believe there's no, people are starving, so even people is in bad situation. So we should work on this for example, like job creation. And also, as a medical doctor, I should say we should never forget the vulnerable group in Afghanistan. For example, the people who are living with HIV and they heavily depends on drugs, imported drugs, and also the children who are living with thalassemia and also hemophilia, that the both blood factors are imported in the country. And also we should taking into account the COVID-19 pandemic, as we are seeing in media, that the COVID-19 pandemic has been forgetting by the people at all, because the pandemic is not the priority. Paying attention to pandemic is not a priority because people are starving. And also the politics, our neighbors and other countries in the world playing a crucial role. For example, Iran or Pakistan, both of our neighbors are experiencing a huge number of immigrants into their countries. So, I mean, this should help with all these peoples. As I'm living in Iran and I'm seeing how hard and bad situation they are dealing with. For example, according to my own experience, I see so many Afghans, they are suffering from severe diseases. They came to Iran illegal, so they do not visit a doctor. Because why? Because they're afraid they would arrested by the police. And you know, it's burning my heart. It's like a bad situation. Yeah.
Absolutely terrible when you reflect upon all the health crises that this country is facing. As you mentioned, the pandemic is way down the list of priorities. There are other intrinsic problems people have to deal with first. They have got to make sure that they have a meal on their table. They've got something to eat every day. Sometimes asking for one meal a day is probably a luxury at this particular stage for many thousands across the country. Dr. Qaderi, thank you so much for sharing your views with us. If we were to ask you on a personal note, how hopeful are you of returning to your homeland sometime soon?
To be honest, in the immediate after the Taliban took over the country, I feel like a person, a homeless person, a person who, I'm the first generation after the Taliban who went to school. I'm the first guest who could go to school after the Taliban, the first Taliban in 2001. So when I get to school, when I attend to school, I was full of hope and dreams for the country. And every day in school, we swear to help for our people and help and try to make something significant and positive for our country. Right now, I'm a doctor. And I think I'm in a place that could help the people. And I think this opportunity has taken from me. And I could not do the thing I really want to do that. And actually, it's not only for me, for my friends and the others I'm in contact, they are saying and experiencing the same situation. But I hope it's solved soon.
That's what we hope as well, Dr. Qaderi. We hope that you are able to return to your country soon, that peace prevails throughout the country and that there is no more instability. There needs to be a moving forward. There needs to be a turning point. This country has had enough. It has gone through so much of turmoil, tribulation in the past. It just seems that the pandemic is perpetuating some of those problems. Some of those main areas that have to be addressed are getting neglected. You mentioned several diseases that are spreading across the country where people don't have medication for it, whether it be HIV, whether it be related areas as well. And this is where countries have an obligation to help a neighboring country, countries in the world, to look upon Afghanistan, because this is, after all, a member state in the global community. It is, if one country goes down, we all go down in the process, and we've got to be very mindful of that. Thank you once again, Dr. Qaderi, for taking time to speak to us, to share your views, to give us an insight into the medical conditions within Afghanistan. Thank you very much once again.
Thank you, my pleasure. Thank you.
Thank you. This was Dr. Shohra Qaderi. She is currently at the Shahid Beheshti University of Medical Sciences in Tehran, Iran, who joined us on the Afghan Views episode, where we focused on the medical situation across Afghanistan as we look at this anniversary, a 6-month anniversary after the fall of Kabul. It is not an anniversary that is being commemorated, but it is instead an anniversary that is being remembered. We're looking back what has happened to the lives of the people across Afghanistan, what changes have taken place, what impact has the administrations or the perpetrated administrations had on its people, what is the impact beyond into the region, and what is the impact Afghanistan is having on the world. Thank you once again for joining us on this episode. Join us again in another episode of Afghan Views when we look back at different views from across Afghanistan. Thank you.